What's going on, everyone? Welcome to today's pandemic update for Thursday, April 27th, 2023. Today we are starting off with my website because I made a few new changes that you should take note of. We've been doing a lot of celebrity health news lately, as there has been less, as there's less data to report on, we got to find different topics to cover. And I think this is an important and interesting topic that seems to interest people, this celebrity health news. So, because of the way I had it laid out on the website, I used to place it under cases of mysterious illness. That's not going to be anymore. I now gave it its own dedicated section called Celebrity Health News, and probably celebrity deaths. That's probably going to get combined with Celebrity Health News as well, and unexpected, unexplained deaths, that will just remain a thing of its own. Also, we now are up to 63 members on the website. I'm glad that it's growing. We're a message board and an archiving site. I like to archive all this information, so you can just go on the site and search it. We have a lovely search bar up here on the site. But here's the exciting change I made. Anyone who's a member of the site can now make a post on the site. I think it's time to allow other people to be able to post as well. Start new topics is basically what I'm saying. Before, you could not start a topic, but you could reply to a topic. And now you can start your own topic. So I think that's a fantastic change. That it was time that I did that. Alrighty. India today. 9,355 new COVID cases in India. 2.8% lower than yesterday. Again, we're still not going to call peak on India. And they did add another 26 deaths. I think we're going to wait an additional week now to call peak on India. Though, yes, they are lower than the high of this wave so far. They're still bouncing around on the top at higher levels than they saw within the last 8 months. So I'm not prepared to say it's dropping yet. And we'll just see what happens as time goes on. Alrighty, now we come to this from Syracuse.com. Indigo Girls postpone Ithaca concert again, this time due to COVID. That's right, they're having more COVID troubles. Due to a positive symptomatic COVID case on April 27th, which is today, show at the State Theater in Ithaca, New York is being postponed again. This is the second time they've had to postpone this. Alright, moving on to this. This has to do with deer. New cases of chronic wasting disease found in North Carolina. Yeah, this is something that's really a problem. There have been no known, or at least not that I know of, I haven't seen it reported yet. There have been no known human cases, but this is something that's spreading in deer in multiple states. And say you're an avid hunter or something and you want to go hunting. Well, if you're in an area that is marked by your state's game commission or whoever regulates the wildlife in your area, and you want to go hunting in the area, you have to have your deer checked for to check that it has chronic wasting disease. They actually have here in Pennsylvania, they actually have drop boxes in chronic wasting disease zones where I believe you leave the head of the deer. I think that's how it works. And they have to check that. And the butchers are supposed to check for chronic wasting disease as well. And the Pennsylvania Game Commission does actively go around to butcher shops in areas where chronic wasting disease is a problem. We don't have any here in eastern Pennsylvania, but in southwest Pennsylvania we do. And here's what some of the symptoms are of chronic wasting disease. Waist loss, stumbling, and listlessness, and other neurological symptoms that occur in deer. This is in deer. Again, I have not seen any reports of human cases, at least not yet. Alright, now we're moving on to this. Who remembers back in the 90s, 2000s, and even the 2010s? That's right, Jerry Springer, the talk show host. You remember? Jerry. Yeah, sadly he passed away. And he also was at one time the former mayor of Cincinnati. And then towards the end of his life, he had a show I think it lasted for 3 years, called Judge Jerry. I've read several different articles. It sounds like he did have some form of a cancer. And that is how he unfortunately died. He was 79 years old. Alright, moving on to this now from CNN. COVID-sniffing dogs can help detect infections in K-12 schools, new study suggests. So some schools now have decided to get dogs to help sniff out COVID-19. And we have not seeing this for the first time. This is not the first time we have seen this. We have seen before where dogs have been able to detect COVID-19. I believe there was a UK study done about a year ago. It may even be on the website. I don't remember. But I do recall that we read in the UK that they were using dogs to help detect COVID-19. So this is fantastic. The more tools we have, the better. Hopefully the dogs stay safe and don't test positive. All right, let's get through today in COVID history. April 27th of 2021. In March 2021, according to the data from the Census Bureau, 18 million adults, 60% of black adults, and 60% of Latino adults, and 6% of white adults, and up to 8.8 million children, over one-fifth of black and Latino children live in a household without enough food sometime in the last 7 days. So that was really bad. And if any of you remember, there was a terrible crisis at the start of the pandemic with getting food, with so many people just being at home at once, not going to essential jobs. Who remembers the food lines? They set them up at stadiums, they set them up at malls. We had one up here at malls that I recall seeing. And just thousands of cars were getting in line for food because you had all these people who were not non-essential employees, who were not going to work, who were not getting paid at the time. It was really bad back at the start of the pandemic. I mean, really bad. Then you come fast forward another year to April 27th of 2022. It is estimated that during the 2000 to 2018 measles vaccine prevented 23.2 million deaths, but delays in routine vaccinations caused by the COVID-19 pandemic and crisis in Ukraine, Ethiopia, Somalia, and Afghanistan have led to nearly 80% worldwide rise in measles cases in 2022. Yeah, the hesitancy or the not going to get the routine vaccines at the beginning of the pandemic because we just didn't know what was going on. That's why it's one of the many of reasons why we're seeing a resurfacing of these old school viruses. There's another reason though, and that being one, there's another. COVID does warp the immunity, so anything that starts spreading can easily spread to other people who have had COVID and may have a warped immunity. So yes, that's a problem. Wastewater, naturally, it's not rising right now. We did do a wastewater update video down below, so we're not going to spend a lot of time on that today. CDC transmission map, it's been updating lately. It's supposed to come in on Thursdays. It's been coming in like late in the evening. That's fine because really in about a couple weeks, May 11th, we're going to lose this altogether. High transmission is at 671 counties. Substantial is at 468 counties. Moderate is at 1,393 counties. Low transmission is at 591 counties. Then we come down to the varying proportion, which I should tell you this is going to update tomorrow. So this is the last day of this data. Tomorrow we should get new data. Again, I'm still questioning, or I hope, if the CDC is watching this, please, after May 11th, continue to report on the sequencing of the variants. Please do not stop this. Keep it going in some way, shape, or form. Thank you. XBB.1.5, 73.6%. XBB.1.16, 9.6%. XBB.1.91, 7.9%. XBB.1.92, 2.9%. XBB.1.51, 2.2%. All right, moving on to BNO and their state updates. New cases yesterday, 46,756. Average, 13,994. That's up by 494, but there's a reason for that. States reporting, 26 out of 50. That's more than usual for a Wednesday. Usually it's 24 or 25. Yesterday it was 26. That's a good thing. In hospital, it is up. 237 increase to 14,086. In the ICU, 1,892. That's up by 92. New deaths, 461. And that brings the average up to 166, which is up by 1. Both the average cases and average deaths, I think, are up because there was one more state reporting yesterday. I don't know what the initial state was, but that's just my guess. All right, New Jersey for today, 223 new cases, 79 new probable cases, 2 lab-confirmed deaths, and 2 hospital deaths in the last 24 hours. All right, let's take a look at Pennsylvania for a second. Take a look at our hospitalizations in my state. We only have 290 people in the hospital now. That's good to see that dropping. And here's something else I found interesting. 5,203 medical beds available. Now, mind you, not all of these are likely staffed, but even if just a large number of these are, this is the highest number of available beds I have seen in my state since the pandemic has started. So this is really impressive. However, pediatric ICU is just 48, and that's only represents 12% of them. That's rather low. Let's take a look at a few counties. Allegheny County, which is Pittsburgh, 48 people hospitalized, 9 in the ICU. Then we'll come down to Philadelphia County, which is the other big county in Pennsylvania, which has 33 people in the hospital, 1 person in the ICU, and that's actually really low. That's some of the lowest levels of the entire pandemic, aside from just after the vaccine. Then we come down to Center County. So we know there's 1 hospital, 4 people hospitalized, and they do have plenty of bed space open this week, 22 medical beds. And check this out. Let's go to Clearfield County. Remember 2 weeks ago we showed they had just nothing available? Well, they still don't have any ICUs, and that's just an ongoing problem even before the pandemic there. They have 2 hospitals, 1 smaller one in Clearfield, 1 bigger one in DuBois, and not having any ICU space, that was a problem before the pandemic. However, medical space, beds, they are up to 10 this week, so that's impressive. It's not very often I get to say they have 10 beds available in Clearfield County, Pennsylvania. So you saw what rural Pennsylvania is like. Let's go to New York State. 595 cases in the last 24 hours, 1.3% positivity rate, 1.5% positivity rate over the last 7 days. Let's take a look at New York State hospitalizations. They have 647 people in the hospital. That's down ever so slightly. 72 people in the ICU. We had Texas update yesterday. 4,532 new cases. 3,814 probable cases. 63 reported deaths. And 6.80 is the positivity rate. Taking a look here at some international data now. South Korea, 9% increase in cases, 58% increase in deaths now, so their deaths are starting to rise. Japan, 16% increase in cases, 29% increase in deaths. India, yeah, look at this. Cases are now down 7%, and deaths are now down 1%, but again, we're waiting until sometime next week to call peak, because I don't want to rush to conclusions. Many of times people have rushed to conclusions to only see it rise again. It's happened in the UK many of times, so we have to watch it. France, cases down 19%, deaths up 5%. Russia, cases down 8%, deaths down 9%. Vietnam, cases are still up 116%, and in the last 7 days they do have 2 reported deaths. Germany, cases down 20%. Deaths down 1%. Australia, cases are now down 71%, and deaths are down 72%. That's rather interesting because they're about to enter their winter now, and here they are. They're seeing a significant drop. Romania, 170% increase in cases, 15% increase in deaths, and today we'll end on the Philippines, which has a 20% increase in cases and a 92% decrease in deaths. So it's good to see their deaths dropping. Hopefully it stays that way. Alrighty, that does it for today's pandemic update. If you like this video, give it a thumbs up. If you want to see more content like this, hit the subscribe button down below. Now I need you to do 2 things between now and the next time I see you. First off, I need you to test negative and stay safe. Alrighty, thanks for watching this video. See you all again next time. Stay safe, everyone.